So well done, congratulations on completing that assessment. Now that you've got your score, you might be wondering what it means and what you can do about it. So it could be helpful to explain how it's calculated. Before I go on, I will tell you a bit about me first. My name is Fulvio Urso Bayarda. I am a consultant plastic surgeon, previously with an NHS reconstructive practice, and then went on to a primarily full-time aesthetic plastic surgery practice. I was awarded Plastic Surgeon of the Year several years ago, and I've treated literally hundreds of patients with conditions very similar to yours, no doubt. So I feel able to tell you a little bit about what the benefits of this treatment can be, perhaps if it's more or less suitable for you, and if it's not right for you, maybe what alternatives you can think about. So back to your score and what it means. So the questions you've been answering are divided up into three main areas. Qualification for treatment at all, what areas of concern you have specifically, and if surgery is right for you, whether you'd be suitable for it. So what do I mean by, first of all, the qualification questions? Well, do you have an issue with your tummy? If you were to, I presume because you're here that you do have an issue with your tummy, but if you tell me you have no body image concerns about your tummy, really whatever it looks like, I'd say don't have treatment, because the aim of treatment is to improve your body confidence, not to create little cookie cutter molds of identical looking people. That's not the aim at all. If you're happy, there's nothing to treat. However, I'm guessing you're not happy since you came here in the first place. Secondly, have you completed your family? Now, if you haven't completed your family and you're planning to get pregnant again, then that will probably ruin the results of almost anything we do. Now, if you were to go for a non-surgical option, that's not quite so consequential, because you can repeat those results, without too much risk to you and too much inconvenience. But if you were to have surgery and then knowingly plan to have kids again later on, that doesn't really make sense. And what I would say in those circumstances is, why don't you defer your surgery until your family is complete, then come back afterwards. And if there are really things that concern you in the meantime, we can think about some non-surgical treatments, or possibly some minimally invasive surgical treatments at most, that could get you to a place that you're happy before then coming back to your definitive surgery once your family's complete. There's a question in there too about lifestyle, diet and exercise. It's really important. You'll get the best results if you have a good diet and exercise routine now and you're able to maintain that long term. Sometimes you're not motivated to have great diet or to exercise at the moment because you can't see results, and I get that. But if you can at least dip your toe and sort of think, is this something you could do? You often find patients become very much more motivated afterwards when they've got great results and just want to maintain them or make them better. And actually, I've seen the most dramatic results, not from my surgery, but that gives people the first step. And then they go on to do great things because they're able to tone in ways they weren't able to before. And that's so exciting. That's the most exciting outcome I think I see. Next areas of concern. Tummy tucks are fantastic for skin excess, and if you have a lot of skin excess, there's really nothing much else that will deal with that other than one type of tummy tuck, a certain type of tummy tuck. Similarly, muscle separation. You can address muscle separation in other ways to an extent, but the real definitive and most powerful way of doing that is with a tummy tuck. If you have fat excess, that can be dealt with at the time of a tummy tuck with liposuction, or it can be dealt with just by liposuction alone, or even some non-surgical treatments, things like fat freezing, can deal with that. And finally, if you're really concerned about muscle tone but don't have many of the other issues, then that can be targeted separately from all the rest by muscle toning interventions, muscle toning treatments. So you wouldn't necessarily need a tummy tuck for that. If you have that in addition to the other things, then you can have those treatments in addition to your tummy tuck, and we can package all of that together for you as part of a care plan and a treatment plan. Finally, if we are going down the route of surgery rather than a non-surgical approach, are you fit and suitable for surgery? So there's a question about whether you smoke. For me, smoking is a deal breaker. You've got to be either a non-smoker or be prepared to stop smoking for 4 to 6 weeks before and after your surgery. The risk of complications is just too high otherwise. Secondly, are you even open to the idea of surgery? Because if you're not, that's fine, but we can explore other treatments that can get you as close to the result that you're looking for as possible, but bar the surgery itself. And finally, if we are really contemplating surgery, then we need to know that you're fit and healthy for it. So having background health issues is okay. Asthma, epilepsy, diabetes, whatever it may be, but they need to be well controlled. If they're not well controlled, we can help you deal with the right specialists to get them well controlled. If they're not well controlled and you don't want to do that, you're unwilling or you can't, or it's not achievable, then again, a non-surgical approach would probably be best for you. So I hope that all makes sense. If your score was less than perfect, maybe that resonates. Maybe you can now identify things that you can do to change that and maybe retake your score and see how you get on. If you feel ready to speak to a professional about your journey and improving your body confidence, then reach out to us, get in touch with us. We are at info@eterno360.com, or you can call us on 01753 840 411. I really look forward to you improving your journey, your destination, getting there, and us helping you if we can. Take care. Bye-bye.